My name's Janet Scott. I work at the Centre for Virus Research in Glasgow, and I also work as a Registrar in Infectious Disease at the Queen Elizabeth Hospital, also in South Glasgow. Before COVID-19, I was working on antiviral drugs, particularly against Ebola and Lassa fever. And also had an interest in post-viral problems with a particular focus on post-Ebola syndrome. So in that regard, I ran some clinical trials during the Ebola outbreak in 2014 to 16 in West Africa, and with colleagues from West Africa, we set up a clinic for Ebola survivors and have been studying the problems that they've been having with their health since Ebola. So in March 2020, when COVID-19 really hit the UK, I really moved my research over to COVID-19 from Ebola and Lassa. So I'm still interested in antivirals and post-viral problems, but now it's drugs that might help for COVID-19 and problems that people who have had COVID-19 are suffering from in the medium to long term. So in that regard, we've set up a clinical trial called Getafix, which is the Glasgow early treatment arm of favipiravir, it's a drug that's got action across a lot of different viruses, but we're going to trial it in Glasgow for early stages of COVID-19 in the community and also in hospital. And also I have been working with the ASARIC consortium to work on follow-up for people who have had COVID-19 but might still be ill. And we already know from Ebola and other viruses, chikungunya and dengue, other things like that, that there are lots of things that can happen and people can suffer from in the long term. So it's not a great surprise that that's happening with COVID-19, and I started working with the WHO and ASARIC in March on that, so that's quite some way forward. And that's what we're up to.